Now, Right to Care says malaria should be treated as a medical emergency. People in Limpopo, Mpumalanga, and northern KwaZulu-Natal have the highest risk of contracting the disease. In fact, infectious diseases specialist Professor Lucille Blumberg says no one should die from malaria. She joins me now from Pretoria. A very good morning and thank you for making the time, Professor. Firstly, congratulations. I know that you have been given the Lifetime Achievement Award for the eradication of malaria. How are you feeling?
Thanks very much and good morning. Well, that's a recognition of many years of work, but in malaria it's always about the team. So I think it recognizes teamwork in combating malaria and responding to cases.
Prof, let's talk about why there are still people dying from this disease, despite all the efforts of education, awareness, and screening, as it were.
So the problem is that malaria presents with fever, flu-like illness, and many people don't recognize the symptoms or the need to present to a health professional urgently, be tested, and receive appropriate treatment. So I think especially post-COVID, and we still have COVID, I think the diagnosis is often missed, often by the patient. They think it's COVID or flu, or they don't tell their health professional that they've traveled, or it's simply not recognized. Overlapping symptoms are the biggest problem. Any delays may result in an unfavorable outcome. Extra 2-3 days after symptoms develop may make the difference.
And when we talk about the education around malaria, is there enough of it, Professor?
I think there's never enough education. And I think coming out of a busy flu season, a lot of COVID in the last few years, I think we need to remind people traveling to malaria area or those living in a malaria, if they develop fever, flu-like illness, they must be tested for malaria urgently, results urgently, and treatment started urgently. Pick it up early, you will have a good outcome. Wait an extra 2-3 days, complicated malaria is much more difficult to treat.
And what more can be done about malaria at this juncture, Professor? Right now, we are heading into the season of malaria. A lot more people are going to want to leave our borders and visit other places, within the SADC region or even beyond. I would imagine you'd want to caution them in some way.
Absolutely. So most of our cases are related to travel to higher risk areas than South Africa. Many of them travel to Mozambique and then contract malaria there. It's been good control in a lot of the areas in the south of Mozambique, but the risks are much higher. So I think protect yourself against mosquito bites. There are lots of effective insect repellents. Make sure you're not bitten. The mosquitoes bite from dusk to dawn, so protect in every way you can. And then I think sometimes you can take medication if that's available, particularly for travel to Mozambique. And I think that high awareness of fever, flu-like illness, and urgent testing on your return. Most people will travel very safely to follow the rules.
In fact, I traveled to Mozambique not so long ago, and I can vouch for the shots working, and they are proven, Professor. Before I let you go, who is most vulnerable to get malaria, and what would you like to say to them, and how would they know?
So just to comment, there aren't any vaccines for malaria. It's about protecting against mosquito bites or taking tablets. Young children, pregnant women are particularly at risk for complications, but anybody in South Africa traveling or living in a malaria, because they don't have immunity, would be at risk. So take the precautions and follow the rules. Fever, flu-like illness, seek care urgently.
Professor, thank you so much for your time this morning. That was Professor Lucille Blumberg from Right to Care. Congratulations again on your achievement for the eradication of malaria.